Stalker here from WestfordCAT, and I am with Westford's Health Director, Jeff Stevens. How are you, Jeff?
Good. How are you today, Patty?
I'm doing good. We've got a blizzard outside, a nor'easter, and everyone's working from home. But then again, most people are always working from home these days.
Yeah, I work from home 2 days a week, and this just happened to be one of them. So
Worked out well.
worked out well. I could get up early, get my snow shoveling done, and just get on the computer.
Nice. I like the backdrop, very festive.
Oh, thank you very much. That's my wife and kids' all creation on the tree.
Yeah, looks good. Fun times. Decorating the tree, that is. So let's get down to the nuts and bolts of it, Jeff. We have a weekly update. What's going on overall in town and with the health department? And, mostly we are focusing on the COVID-19 pandemic. So today is going to be no different. And I know there's a few things that we talked about touching on. And one of them is the vaccine rollout and how is that going to work in the state and then opposed to how it's going to work in the town of Westford.
So that's a great question, and a lot of people are asking that question right now. Right now, we do not have the vaccine in hand. It is not at the health department. It is not in any of our vaccine refrigerators. Part of the reason is the Pfizer vaccine needs to be kept at such a cold temp. We don't have the capacity to do so at this point. Additionally, the state is handling most of the phase one rollout, and they have not given the local health departments any guidance on what their actual role will be yet. I anticipate in phase two or phase three that there will be mass vaccination, and it will be similar to how we handle flu clinics.
Mm-hmm.
We're working on our plans to beef those up a hair just because we're expecting the normal 1,400 people that would get vaccinated. I'm going to expect a far bigger number than that are going to want the vaccine at that point. So we're working on that plan of where it'll happen and how we will schedule it. So as soon as we have more information, we'll pass it on to the general public for sure.
That's great to know because I'm sure, a lot of people are anxious and really want to get this vaccine. And of course, the frontline workers and hospitals are going to receive the vaccine first. And so whenever we get the vaccine in Westford, you'll be sure to let the public know.
Yes, and it will obviously be targeted towards the phases,
Mm-hmm.
and whichever group of people is going to be vaccinated, we will notify that group if it's even local health departments doing it, or if that's going to fall to the state at that point on how they're going to handle it. There's still a lot of unanswered questions. Right now, mainly the frontline workers in the hospitals and hospital care centers are getting those vaccines.
Okay, great. Thank you for clarifying that. I think a lot of people were wondering. So another thing, Westford has shifted into the red zone a couple of weeks ago. And why don't we talk a little bit about that? How are we doing right now?
So we have stayed in the red zone. Our percent positivity has gone up to 6.5%. And what I'd like to do is clarify what that number really means. To me, what that number means is 6.5% of the people that actually got tested were COVID positive. Now, that was 146 people in that particular data pool set out of 2,246 cases or tests. 146 were positive. You do the math, you get 6.5. That is not 6.5% of the population. The population of Westford is in the neighborhood of 24,000. So there's a big, big difference in the percent positivity. So I don't want people to get alarmed that they think 6.5% of the population is affected. It is not. The whole population is far lower than that.
Yeah, I think a lot of people are confused in that. So many numbers get thrown out. If you go to the mass.gov website, there's so many different charts. And I think when people hear 6.5% positivity, like you said, they're thinking it's the population. But no, it's 6.5% of the people that have been tested.
And in a place like Westford, what I see is the most people that are getting tested are the people that are sick or they know they've been a direct contact. So that's where you see the testing coming up. In other communities where they have stop the spread sites, you may have a far greater volume of people getting tested because it's free, it is close by, and they're more likely to do it if it's an easy option. I've asked the state to be a stop the spread site for Westford and Chelmsford. To date, they haven't felt the need that they need to put a stop the spread site in this particular location, but I'm going to continue to ask to get free testing here in our part of the state.
Yeah, explain a little bit about Stop the Spread sites.
So the Stop the Spread sites are put in by the state, they're funded by the state, and local health departments will either help run them or man them completely. But there is some state oversight, and all the supplies are supplied by the state. And they're usually put in areas where you've got a large amount of people that are getting sick. Lowell had a Stop the Spread site for a while. They were getting hit with hundreds of cases a day. Talking to a colleague, they had a couple of mornings ago, they had 193 cases in the morning. That's 193 cases in one day.
Wow. And
That's
half a day.
That's a big number. Of course, they are a larger population. They have a lot more density. Westford is a far less dense community. That said, we still need to do the things that we need to do to protect ourselves, and that is the social gatherings. That is making sure you're not doing them, wearing your mask when you're out in public, washing your hands, socially distancing. We have to do these things on a regular basis.
You know, the social distancing, you know, you're required to wear a mask, whether you're indoors or outdoors, even if you're more than 6 feet away
Correct.
from someone. And, you don't see that everywhere. I see, bikers riding without their masks on and whizzing by. And so I just want to remind people that even if you're 6 feet apart from someone, indoors or outdoors, unless they're in your family bubble, you need to wear a mask.
Correct. And if you throw a party or there's a large social gathering, we've had to already issue fines.
Mm-hmm.
And the health department is not interested in fining people, but at this point, if people continue to have gatherings, we're going to issue fines. There's a few examples of that have happened already, and I'm hoping that we're done with doing that. I'm hoping people get the message, and I hope they stay, especially for Christmas. I know it's going to be hard, but even at my own house, it's going to be my wife and my 2 kids, and that is it.
Right.
Nobody else will be in my house.
I know it's going to be tough, but we got to do it. We got to buckle down. I want to stop this thing or slow it down anyway. So,
Absolutely.
Yeah. So, Jeff, anything else you'd like to say?
The only other thing I'd like to add is that I wish everybody a safe and happy holiday, and stay vigilant. We know the vaccine's coming. We're one day closer to more people being vaccinated. I have actually also asked the state to provide a weekly update on how many vaccines have been given out, so we can start comparing what the mitigation numbers look like compared to the people that are getting sick. It'll be nice to see those change position at some point.
Wouldn't that be great? Yeah. Like you said, there's a light at the end of the tunnel. It's just a long tunnel. So.
Right.
All right,
Stay
Jeff.
vigilant, everyone. Just keep pushing away at it.
All right, Jeff. Thanks a lot for your time, and we'll check in again soon.
Thanks, Patty.
For WestfordCAT, I'm Patty Stalker.